Hello, my name is Mark Griffin. I'm joined by Dr. David Bloom, and this is AMI-Quebec's first in our new video YouTube series on talking to experts in the mental health field, conversations really. We're going to be talking about psychotic disorders today, and so Dr. Bloom is the medical chief at the Douglas Institute's Psychotic Disorders program here in Montreal, Canada. He's also an associate professor at McGill University's Department of Psychiatry. Welcome, Dr. Bloom.
Happy to be here.
So I'm just going to start very generally speaking. What are psychotic disorders?
They're a group of mental illnesses in which the patient has certain kinds of experiences. There are perceptual experiences which are very real to the patient, which are not really there, such as auditory hallucinations, visual hallucinations, olfactory smell hallucinations, gustatory taste hallucinations, touch or tactile hallucinations, and more rarely body or somatic hallucinations. There can also be delusional ideas. That is to say, for the patient, these are true ideas, but for everybody around the patient, these are false ideas, but they are firmly held and not consonant with any held beliefs by a religious or cultural group. So they're false beliefs, essentially. And they can be of many types. You can have persecutory ideation, paranoia. You can be having somatic ideation, worried about your health in a very delusional, irrational way. Delusional guilt in depressed people. You can have delusions of grandeur. You can have what we call fantastic delusions. I'm the king of Mars, I come from outer space. So there are many things like that. Then finally, in the psychotic disorders group, you have what we call a thought disorganization or thought disorder symptoms. So the person, and this reflects the internal difficulties that the person has in organizing his or her thoughts, and they come out externally. And what we notice from the outside is just that. We have a hard time to understand what the person is saying because the speech seems to be very disorganized, to the point sometimes where the person can actually have what we call a word salad, where even the words are not respected. So the patient is talking in syllables and we don't really understand what is going on at all. So that's for what we call the positive symptoms of psychotic illness.
Are there different specific types of psychotic disorders?
Yes, we can have psychotic symptoms in a variety of illnesses, and they don't necessarily have the same biochemical or anatomical origin in the person's brain. For example, from the external sources, we know quite well that certain drugs can cause psychotic symptoms, and some people are more sensitive to them than others. Marijuana's received a lot of press. Certain things like cocaine, amphetamines, certain hallucinogens like LSD and other types of hallucinogens can cause psychotic-like symptoms, which are externally induced. One can even have psychotic-like symptoms induced by poor sleep and so on. Then we have internally generated psychotic symptoms. Most of the time we would talk about psychotic disorders proper, and this would include the schizophrenia family of illnesses. This would also include mood disorders such as bipolar disorder, where about 25% of people will have psychotic illnesses. Major depressive disorder, where about 10% of people will have psychotic kinds of symptoms. And also some less common psychotic disorders like delusional disorder, where one might just be thinking, my husband is jealous of me, or where one has erotomanic delusions, such as a person is thinking that a well-known person is in love with them and harasses the person. So that's much less common kind of presentation.
So that would have been like the incident with the person chasing Jodie Foster in the early 80s.
That's exactly right. And finally, in the group of internally generated psychotic types of symptoms, you have people that have dementias, unfortunately, the variety of dementias where, as part of the general decline, people can have a variety of the symptoms I've mentioned, both more typically persecutory delusions. People are stealing from me, misidentification of people. You're not my son, you're not my daughter, not just a cognitive problem, but sometimes a recognition problem. And sometimes hallucinations of a variety of sorts.